I'm going to show you a map. These 10 states set new coronavirus records. The contours of the crisis are a little bit different in each of the states. Some set new case records for a single day. Some are overtopping their 7-day averages, but the end result is the same. When the number of sick people goes up, so does the number of people in the hospital, which means eventually the hospitals struggle just to keep up. This is the headline out of North Carolina today. Reported coronavirus hospitalizations soar to another new high. Same thing in Texas. This headline today is a particular gut punch. Officials say many more people will get sick and die if increases in hospitalizations continue. The situation in Arizona, hospitals, that one is particularly dire right now. At the start of this week, ER visits, ICU bed usage, ventilators in use, all of those measures hit a record high. The governor of Arizona has said not to worry, that hospitals are plenty equipped to handle the coronavirus epidemic that is spreading unimpeded in his state. And so the doctors in Arizona are sounding the alarm for him instead. One ER doctor, alarmed by the surge of sick patients in his hospital, telling the Arizona Republic, quote, "I'm taken aback. I walked into the hospital and I was like, oh, my God." He says what he is seeing in his ER tells him the situation in Arizona is not as bad as the numbers are showing. He says he thinks it could actually be worse. Joining us now is that Arizona ER doctor, Dr. Murtaza Akhter. He's a clinical assistant professor at the University of Arizona College of Medicine in Phoenix. He works in 2 different Arizona hospitals. Dr. Akhter, thank you for joining us. Please tell us what you've been seeing in the ERs in Arizona and what has you so concerned about the course of the outbreak in that state right now.
Hey, Ali, thank you so much for having me. Basically, what I've been seeing in the ERs is sort of what you would have expected based on the data, except to me, it looked even worse. I knew going into my shift just a couple days ago that the numbers in Arizona were surging. We were making national headlines, which is never a good thing to make national headlines for. And yet, as you quoted, I was taken aback by both the patient volume that we had in the emergency department, as well as how sick they were. A lot of them had significant respiratory complaints, what we call influenza-like illness. And as you can guess, almost all of them that we tested and had results for tested positive for COVID. It was really crazy to see not just the volume, but how many of them were sick and how many of them were COVID positive.
And in our world today, in 2020, we're used to real-time data. But one of the things we've struggled with since the beginning of this outbreak is the delay. You told the Arizona Republic that what you're seeing makes you think that the data hasn't actually caught up with the reality. What do you mean by that?
Yeah, well, as a researcher, I always like to focus on the data rather than anecdotal experience. That being said, to have that many people in the hospital come back positive told me something was off. I mean, I've been working in the emergency department for years, right? And we've been doing COVID testing for many months. And so we've noticed that before at the early onset stages, only some people were COVID positive, then more and more, to get to the level where I literally asked my colleague on shift, who was the other attending physician, hey, have you had any negative tests? And he told me, we've had one. Wow. So that gives you an idea of how bad it is. If we're talking about one case that was negative, all the ones we tested.
A couple of days ago, the president said if we just stopped testing, we'd see a drop in the number of cases. And I suppose we'd see a drop in the number of reported cases, but in fact, that wouldn't result in a drop in the number of people who are actually getting the infection.
That's exactly right. I mean, I guess I can't disagree with the statement. If you don't test anybody, I suppose nobody will be positive. So that's a sort of tautological argument. But our job as physicians is to find the disease. In the case of coronavirus, we do that not just by how they look clinically, but whether they test positive for COVID. And the number of cases is skyrocketing. There's some people making this push that, hey, listen, we're testing more. Of course, it'll be more positive. That's fine. You're going to get more cases if you have more tests. But the positivity rate is also increasing. So not only are you testing more, which in theory should drop the positivity rate as you're doing more widespread testing, including of asymptomatic people. Quite the opposite. Our positivity rate is going up, and by a lot. It's honestly, it's almost shocking. Maybe I shouldn't be surprised, but I'm kind of shocked.
Dr. Akhter, thank you for joining us. Dr. Murtaza Akhter is a clinical assistant professor at the University of Arizona College of Medicine in Phoenix. We appreciate not just your time, but the work you are doing to get us through this crisis. Thank you, sir.